All right, I think we're live between all the streaming platforms. Okay. So today I want to talk about neurological conditions. So neurological conditions are many. They usually involve some sort of damage to the nerves. So the nerves, other than the yellow wires that we draw out in our anatomy books, are part of the neurology. That's the peripheral neurology, right? So if you hear that term, that's what we're talking about. So when we look in a textbook, we are talking about those yellow drawings that look like little branches and trees in our arms or our legs, and those nerves actually have the function of bringing sensation, right? So when we feel pain or a poke or movement, and then there's motor function, which is actually moving in space, but not just movement, but movement in space, meaning like how I move my arm around. That's proprioception. So they're highly complicated. As I mentioned to everybody, nerves are complicated structures. So with complicated structures and tissue, treatment becomes more long-term. So a perfect example, chronic pain is pain we've lived with for a long time, and the body doesn't really know what to do with it. But that pain is in the nerve pathway. I mean, there's a lot of reasons to have it, but it's complicated. Otherwise, it would just go away easily. But the one thing that we overlook when it comes to neurology is the central part, right? The brain and the spine. So these wires, these nerves, the peripheral nerves from the tip of our toes will go and enter into the spine and then into the brain. And the brain, actually, we think of as an organ, but what it is a highly specialized nerve, right? We have so many nerves attached or next to each other, right? So one of the things in the nerve pathway is like a wire. It's insulated, it has a coat of fat around it that protects it. It keeps the signal from spreading all over the place so that it gets from the foot to the brain, or it gets you to move your hand or feel something. But when it gets to the brain has to do so much that those nerves, right, are uninsulated. They don't have, there's a coat of fat around the outside, but generally inside the brain, the gray matter or the white matter is actually unmyelinated or uninsulated, so that we can have this shortened period of time between nerve signals, right? Activity. So a thought, right? And a thought and then a movement requires a lot, but a thought in the brain requires a lot more, right? So we think about we use a term called neuroplasticity, right? And neuroplasticity is how we create a nerve pathway for a thought. So I'll say to you, like a Homer Simpson, and you think of Homer Simpson, and that image, right, is an actual nerve pathway. So when we think of complicated things like language or riding a bicycle is a perfect example. Once we've established that pathway, that neuroplasticity, we can't unlearn it. We don't forget it, right? It's always there. Or maybe we're a little rusty, but we always get back on the bicycle, right? We use that. It's like getting back on a bike. That's neuroplasticity. So learning a language, learning a discipline, playing an instrument. These are the things that create, new pathways in the brain. And because they're so complicated, we can't be bothered with insulating that nerve pathway because there's so many of them. And that's what makes the brain so complicated. Now, when you have a problem, right, say centrally in the brain, like a stroke, or we have traumatic brain injury, where we have direct trauma to the head that shakes the brain around and causes some damage, or we have some degeneration like in Alzheimer's or Parkinson's, now something happens centrally in the brain, and that affects, right, our motor and sensory function. So if we have a stroke, we lose use, we have paralysis, we lose the motor function, and maybe we have some numbness, we lose the sensory. Right. When we have things like tremors due to Parkinson's or Alzheimer's, right, we have a problem with the motor function. Something happens, the brain tissue deteriorates, and now we can't control our movement, and we have involuntary movement, right? And sensory-wise, we may have some other stuff that goes on. And then finally, with traumatic brain injury, right, an actual trauma to the brain can scramble all those signals so that we can't conjure the image, or we conjure the image of Homer Simpson, but we can't remember his name, and we know. Or perfect example, when we have a stroke and it affects the the motor speech aspect, the way we use our tongues, or the sensory aspect of recalling a word. Maybe we know the word, or maybe we know the image, but we can't phrase it. Something happens in the tongue. So, needless to say, neurological conditions are very complicated. So, I have the honor of addressing a support group around neurological issues. So, we dealt with traumatic brain injury, we dealt with stroke, and we talked about Parkinson's. In all these, they were asking, can acupuncture help? And the truth is, acupuncture can help, but how does it help? So we had to really kind of walk backwards, which I always do, is introduce the steps to acupuncture, right? What are the 3 effects of acupuncture? And those effects are the local effect, right? How do we affect the brain locally? How do we affect the tissues locally? How do we affect the brain centrally? And how do we affect the nerve pathway regionally, right? Over the course of my streaming, we've mentioned these over and over again. So locally, right, in the case of stroke or paralysis, we want to kind of innovate and activate those muscle groups again. So by increasing circulation to the area, we're improving and overall activating the nerve pathway. So when we activate the nerve pathway, we wake up that part in the brain. So we think about pathways from the brain out to the hand, and I have a conscious thought and I say, I'm going to move my arm, right? So that requires a lot. So in stroke, we lose that ability. So we have to wake up from here, the muscle, we have to increase circulation, we have to build that muscle back up, but we actually have to sort of activate that pathway from the muscle to the nerve. And what people think is that nerves actually are like a switch where we turn something on and the muscle moves, but unfortunately, it's a little bit more complicated than that. It's a little more, there's a step in there. There's a chemical release. It's called acetylcholine at the end of the nerve that binds to a muscle receptor that activates the muscle. So when we introduce the filament to the area, what we're doing is we're kind of activating that local chemistry to create a muscle and a movement and so on and so forth. So locally, we're improving that function, and that chemistry there actually travels up the nerve pathway and wakes up what's called the sensory. In order for us to feel, we improve the motor, but we're also improving the sensory pathway, how we feel the muscle or how that muscle activates in space, right? And then finally it gets to the brain, and we wake up that portion of the brain that starts that nerve signal. So that conscious thought, that neuroplasticity of me moving my arm. When we're babies, we're kind of stumbling all over the place. We need to build neuroplasticity. And in that nerve pathway of moving my arm, we have to wake that up in the brain. So we do that locally, centrally, and regionally over the nerve pathway. So that's for stroke. In the case of Parkinson's disease, where we have like the cell, the nerve cell, the brain cell, right, is kind of falling apart or deteriorating, we need to, hello, Jacqueline, just in the middle of streaming here. I'll call you back when I'm done. We actually what we do is we create better nerve cells in the brain. So when our brain cells start to die off because of a degenerative disease for some reason, whether it's genetic or just over time as we get older, we don't make as good cells. That's why we have that age-related dementia. We lose the ability to replenish the cells and they start to deteriorate, right? There's a way of increasing circulation to those brain cells in order for those cells to come back and be better and stronger. And that's the epigenetic effect, right? When we do acupuncture, we get to the DNA level and we create better cells. We create better functioning cells, better DNA, which in case create better cells that function better. So in a neurodegenerative disease where our cells are kind of falling apart and dying off, we are, with acupuncture, rewriting the script in the DNA and asking the body to create better quality brain cells so that A, we keep it from progressing. I don't know that we can cure it, possibly reverse some of the damage, but definitely keep it from getting worse. We've seen that in cases with MS. where people deteriorate, the immune system attacks the central nervous system, and people develop certain issues. We can divert the immune system away, which gives some space for the neurology to improve. But in the case of Alzheimer's and Parkinson's, we can actually create better cells, better brain cells, in order to preserve that neuroplasticity of movement and things like that. Traumatic brain injury, right? You take a nice blow to the head, it cleans your clock, as we say in boxing or in martial arts. You take a shot to the head and you see stars. Well, guess what? You actually have a physical trauma. Now, yes, there is some permanency, and if we leave it and let it go, it could deteriorate. But if I've said anything enough, right, hijacking the body's ability to heal itself, right, taking the filaments and putting them on certain areas around the scalp, around the head, we can improve the overall quality. We can reverse the damage done by a trauma and improve the function over time, right? So neurologically speaking, there's a lot we can do with acupuncture, and it all does require some pathways, but the core of it is neuroplasticity, right? How do we improve the functioning of overall, how does the signal get from the brain to the hand, right? How do we improve the function of, flexing our muscles once we've lost that from like a stroke, right? What is a stroke? A stroke is a piece of something that gets stuck in the brain. All of a sudden that part of the brain isn't getting good blood flow and it loses the function. And that's where we get the paralysis. So we have to kind of dredge those channels. We have to increase circulation. We use an aspect of acupuncture called scalp acupuncture. And what that does is we use the brain map. Like on the brain itself, we have a map, right? And the lower part here is our feet, and it travels towards centrally the head, and then we take over and we use some organ function. So it's called the homunculus, right? It's a concept of neurology where there are maps on the brain that we can access through the skin of the scalp. So when we agitate or we do treatments on the scalp, it wakes up those nerve pathways. So we can correlate to the hand, we can correlate to the feet, we can correlate to the motor aspect of the mouth so that people can speak properly again. But it all ties into the brain, where we have to activate that history, that database, right, of neuroplasticity. We need to wake up that part that helps us use our tongue in the right way to say the word that we want to say. We need to wake up that part that tells us how to move our hands and type and fit, ride a bicycle. That's the neuroplasticity. And that's where acupuncture is really good at helping to kind of wake up those pathways. Because at the end of the day, it's all very complicated. The tissue is complicated, but the solution should be simple, right? Increase circulation, right, to the areas that need it, over the pathway, and then eventually in the brain. The three effects of acupuncture: local, regional, and central, right? And hopefully we've kind of demonstrated that today. If you have any questions, feel free to reach out. And then the fourth, of course, is the epigenomic, which is a little bit more complicated. It's complicated to discuss, but the truth of the matter is, in order for your brain and your nerves and your muscles to work, they need to be of a better quality. So what we can do is on the genomic level, improve muscle cells, nerve cells, and brain cells. So with that being said, thanks for listening. We'll be back soon with more. Thank you.